Our study evaluates sexual health curriculum across medical schools in the Midwest with the goal of seeing what future physicians are learning about sexual health and whether or not they're prepared to really take that into the real world, into the clinical practice. And while we found that schools did include foundational topics like anatomy, embryology, STIs, and birth control, there were significant gaps in other more clinically nuanced and patient-forward scenarios. So for example, while vulvar anatomical abnormalities were present in less than 10% of curriculum, things like female sexual pain, like dyspareunia and vulvodynia were in less than 25% of curriculum. And those are real things that patients experience and often struggle going to the doctor or going to a healthcare provider to address those concerns. And so our study really shows that sexual health education is, while it's present in curricula, it is often incomplete, inconsistent, and lacking that patient-forward approach. Our findings suggest that Midwest medical graduates are underprepared to address sexual health concerns in clinical practice. And I know our study is just in the Midwest, but prior literature and prior studies have shown similar gaps in other regions of the United States. So this suggests that perhaps it's not a regional issue, but more of a national one. And the Midwest also includes a mix of different types of schools and institutions. We have private, public, urban, rural areas. So in many ways, it kind of represents a microcosm of the broader U.S. medical education system. So taken together, our findings likely reflect broader systemic gaps in how sexual health is prioritized and taught across the country. Absolutely. There are huge downstream effects and consequences of this. So when clinicians are not taught about normal vulvar anatomy and different vulvar anatomical variations, this can lead to excessive diagnoses. It can lead to excessive treatments. It can lead to, in the exam room, patients may feel shame or distrust in the system because they are feeling like their anatomy is abnormal, would you say? But there are so many different types of variations. And then on the other hand, with clitoral abnormalities and clitoral conditions, it's so important to learn about these things because so many patients come in with these concerns and they don't know what's going on. I mean, I didn't learn about the Q-tip test until I became more involved in sexual medicine research, and which I think is such an important part of sexual health. And so many patients, it takes years and years for them to finally receive a diagnosis. They go, from doctor to doctor and see so many different specialists before they are able to get a correct diagnosis and correct treatment, and have to tell their story over and over and over again. And I feel like that is very draining. I mean, if I had to do that, I would be very discouraged from seeking care in the medical system. So those are some of the downstream effects and why future physicians, future clinicians should be learning about these things.